Breaking news. I think that was good.
Reporting live from Channel 32, we're talking about the state of emergency we're in with Lyme disease, and this is Melinda and Corey, and I'm Marissa. And you may be wondering, what is Lyme disease? Well, it's an infection caused by the bacterium Borrelia burgdorferi, and it's transferred by deer ticks and black-legged ticks. And these ticks are found in wooded areas. So who should be concerned about Lyme disease? Well, it's most commonly found in children and older adults, and people who spend a lot of time doing outdoor activities. And it's found all across the U.S. and most commonly in the Northeast and upper Midwest regions. And about 300,000 people are diagnosed in the U.S. each year with Lyme disease. But where did Lyme disease originate and when was it discovered? Lyme disease originated in Lyme, Connecticut, and it started as an odd series of rheumatoid arthritis cases in children, which was later determined to be Lyme disease. In the mid-1970s, Lyme disease was officially named and discovered. And it wasn't until 1981 the link between the deer tick, the bacterium, and the disease was discovered. And now here's Corey reporting about transmission of the disease.
Thanks, Marissa. As Marissa said, Lyme disease is transmitted by deer ticks. They're black-legged ticks, and they sit on top of tall grasses in the spring and summer. Some people believe that they jump or fly onto the host and infect the host with Lyme disease, but actually they crawl. They don't jump or fly at all. The Lyme disease causing ticks are infected with the bacteria Borrelia burgdorferi, and usually the ticks that infect people are nymphs. That means they're very small. They're immature ticks. They are hard to see without close examination of the skin. So they crawl onto the host as the host walks by the grass or the tall leaf, and they crawl into areas such as between the legs, under the arms, and behind the ears. They bite down and secrete fluid that helps them stay attached to the host, and within 36 to 48 hours, they can infect the host with Lyme disease. Lyme disease cannot be transmitted from person to person, so if your child has Lyme disease, you don't have to worry about touching them or breathing or anything like that. And also for pregnant women, it is not transferable from the mom to the fetus. Now Melinda is going to be talking about signs and symptoms.
Thank you, Corey. So the most common signs and symptoms are flu-like symptoms like fever, nausea, joint pain, muscle aches, chills, sweats. Some may experience Bell's palsy, which is a drooping of the face, but the most characteristic symptom is a circular rash shaped like a bullseye. In the more chronic stages, you may experience an increase in joint or muscle pain, sleep issues, cognitive and neurological changes, and in a rare case, Lyme carditis, which is a bacterial infection of the tissue in the heart, which can interfere with normal beating of the heart. These symptoms, as you may notice, overlap with many disorders, so be careful because they are often overlooked. Now we're going live with Becca in the woods in Lyme, Connecticut.
Thanks, Melinda. I am here in the heart of the problem in Lyme, Connecticut, and I'm here to tell you about how to prevent Lyme disease. Like they said, it is transferred from ticks, and so you want to avoid wooded areas at all costs if you can, because that's how you get it. But if you can't and if you're outside, then I'm going to teach you some guidelines to follow. First, you want to wear long clothing. So long sleeves like this. I put my hair up and a hat on, and I got long pants on. So you want to protect yourself. Also, light clothing helps to see ticks before they attach to you. You want to stay on the paths. You don't want to brush up against anything with the grass or anything like that. There's also repellent that you can get that you can put on your clothes, on your skin, on your gear to repel the ticks so they're nowhere near you. Also, do periodic checks of your skin, of the areas that Corey taught you about, and you don't want the ticks to get a hold of you. So, and you also want to remove them quickly, and you do this by using tweezers. Do not use fire. People think that. Use tweezers. And you also want to protect your furry friends. You can go to your veterinarian. They'll give you stuff, put it on them. You want to protect them because they can also bring it into your house and get on other stuff. And you don't want any ticks around you. So that's all I got for prevention. I'm going to send it back to you guys in the studio, and I'm going to go inside away from the ticks.
Thanks, Becca. Back in the studio, but we are actually going to send it to a specialist, Dr. Boucher.
Thank you. So the earlier that you treat Lyme disease, the better. And most patients will be prescribed a long-term dose of a broad-spectrum antibiotic. They will be prescribed doxycycline, which inhibits protein synthesis inside the bacteria cell, and also cefuroxime, ceftriaxone, and amoxicillin, which bind to the cell wall, causing cell rupture and cell death. You can also take ibuprofen for joint pain and inflammation. And so here, I made this diagram about bacteria and how antibiotics work on it. So here you have your bacteria, and then once you add in the antibiotic, which leads to the cell membrane rupture, which leads to cell death. And so that's the treatment. Thank you.
There you have it, everybody, and now you know everything you need to know about to keep safe from this outbreak of Lyme disease. Thank you for joining us.
Good work, everyone.